try to take the vital signs of the child. Always keep your equipment ready, and it should be placed well on the table, right? So that whenever you are taking, everything is available to you, right? So this is the torch, this is the pulse oximeter, thermometer, tongue depressor, so and right. So then you should sanitize your hand so that you are not transmitting any infection to the patient. Third is you should explain the procedure. Sometimes some patients are very anxious. You can explain it to the patient directly if he can understand, or to the parents also, that we will be taking him blood pressure, temperature, all these readings, and there is nothing to worry about it, so that they do not unnecessarily panic, right? And after once you have taken the reading, try to note them down, otherwise you will forget and you will not be able to bring the proper reading. Note down on the OPD ticket of the patient, or the blood ticket of the patient, right? So first is the pulse rate. Pulse rate, which are the main pulses in the body? One is radial, brachial, carotid, femoral, tibial and dorsal rate, right? So usually we take the radial pulse for in the pulse. When you are calculating the pulse rate, what you will do, you will note down the first the rate of the pulse rate, and what is the rhythm, the character, volume, and whether there is a delay from the femoral, and on both sides is it the same or there is some difference, right? Rate, you understand, you will count it for 1 minute, or you can count for half minute, 30 seconds, and then you can multiply by 2. Rhythm means whether the pulse is coming at a regular interval or not. If it is coming at like this means the rhythm is normal. Or if it is coming and then there is a gap, again irregular pattern, then the rhythm is not regular. What is the character? Character means sometimes the pulse is coming with a large stroke, the character is different. Sometimes the pulse pressure is low, then also it differs. Volume also, you will know as you will place the hand on the pulse, radial pulse. I tell you an example. Once there was a big number of patients who were hurt in the bus accident, roadside accident, and about 20 patients were admitted under us in the emergency. I was the doctor on duty at that time. So the other doctors, they shifted some of the patients who were looking okay. हाँ जी, ये पेशेंट ठीक है, इसको वार्ड में शिफ्ट कर दो, ये ठीक है. From emergency the patients were shifted to the ward, taking it that they are okay, normal, they are only minor injuries. So when I was taking the ward round, I placed the hand on one of the patient's pulse. So the pulse was just not palpable, very feeble. So then I asked the staff nurse to shift immediately patient to the emergency, and then further investigations were done, and it was found that the patient has splenic injury. You know, spleen, it is in the abdomen, and there was lot of blood in the abdomen, and the patient was in shock. So pulse rate gives you a very good indication about the perfusion, circulation in the patient. This is a very good bedside Please don't disturb, go out. And respiratory rate. What is the respiratory rate? On this you have to note down again, or preferably 1 minute or 30 seconds, and you can multiply it by 2 times, right? So this you can do by inspection. As you take inspiration, you know that the chest expands. During expansion, you count 1. Again during expiration, it will contract. Again during the second inspiration, it will expand. So you count, keep the watch, 1, 2, 3, 4, like this, and then after 30 seconds you multiply by 2. Here the important points are whether the both sides are moving equally or not. So sometimes if there is pathology on one side, that side may not be expanded. So you have to note down whether both the sides are expanding or not, right? Third is, sometimes the patient takes a very brief inspiration because he has got pain in the chest. Even if you ask the patient to take a long breath, he will say need pain. He will not be able to take deep breath. It may be due to pleurisy, pain in the pleuris, right? Third is the CRF. Capillary, what is CRF? Capillary, you can note down, capillary refill time. Capillary refill time. How to note it down? You have to take the finger of the patient. So someone can come, volunteer. We will press on the nail bed for 3, 2, 1. Now immediately it has got refilled with after procedure, right? First it will get blanched and then it will get refilled. You can try on your own hand also, right? 3, 2, 1, it will get blanched and immediately it will get refilled. So it should be less than 2 seconds that it gets refilled. If the refilling is delayed, then you will call it that the perfusion is not right. So this is also a very good bedside vital information for which you don't need any complicated equipment. Third is the temperature. Temperature normal is 36.5 to 37.5 degrees Celsius. It is in Celsius, and this is the thermometer, normal thermometer. We will learn about the other methods also. So we are just telling in the main points about. You have to try to keep a separate thermometer for every patient when the patient is in the ward. Otherwise, if you are taking, you must sterilize it before putting it into the mouth of another patient. You should properly sterilize it, sanitize it, so that infection is not transmitted. You can place it under the tongue also or in the axilla. And these thermometers these days, they are digital, they will give a direct reading. Previously there used to be mercury thermometers which are not now these days used, right? So next is the very important pulse oximeter. Pulse oximeter. This is the pulse oximeter. It will tell you about the oxygen saturation in the body. You have, this is like this, and you have to press. Any volunteer can come. Any volunteer. This is the, we will press it from here, make it on. You see, it has started working, and we will, there is a red light in this, and we will place it under the red light, right? It will give the reading. Both two readings will come here. Just it has 98. 98% is the oxygen saturation and 73 is the heart rate, right? So this is how it works. You can also try it on your hand. Very simple but very good information. Oxygen saturation, right? Anyone else? Any volunteer who wants to come? Can do it. Come here. So this is the, you make it on from here and press it, and this is like a clip and you hold it. So it is 98% and 82%. This is also normal, right? Okay, thank you. So thank you. If you want to ask, you can ask.